How should I get rid of and what may be the cause of bags and discoloration under eyes? I think it may be from dehydration and drinking a little too much, but I have improved that from last week and it's still not getting much better. I am only 32 and feel like it really ages me.
Thank you for your question. You're 32 years old, you've submitted 2 photos, and you describe in your question a concern about how to get rid of as well as what is the cause of the under eye bags and discoloration. You state in your question that you have had some issues with dehydration and drinking so much, but things have improved over the course of a week. And so basically you're looking for guidance as to what to do about the under eye bags and the discoloration. Well, I can certainly give you some guidance as to how I approach people like yourself who come to our practice. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Under eye bags is one of the most common issues that we deal with and we provide solutions for in our practice for over 20 years. So it is important for you to understand the cause before you define the solutions to what you're dealing with. Certainly the most important issue besides the underlying cause is, of course, your general state of health. And it would be its duty for me to at least advise you to also manage and minimize alcohol consumption and anything that causes dehydration and do things that are best for your general health. I'm very much of a proponent of healthy lifestyle and healthy living. There is nothing that is better for any outcome for any procedure than a patient who takes care of themselves. Someone who smokes a lot, doesn't eat enough, doesn't sleep well, basically stresses their body. So that point being made, let's discuss what the anatomic issues are. To begin with, what causes the puffiness? Puffiness is caused by something called lower eyelid fat prolapse. Fat prolapse means that the fat that's normally around the eyes pushes forward, creates this bulging of the under eye area that is persistent. And you look at yourself and you say, you look tired, you look like you haven't slept. And very often people will tell us that they're constantly being asked if they slept enough or if they've been doing drugs or drinking. Essentially, under eye bags communicate so many things that are not advantageous. Beyond that, discoloration of the skin does have many different levels. Going from top to bottom, the external element of the skin, the epidermis to the dermis level, is affected by the environment, sun exposure, smoking, or general environment, wind, anything, or even as something as like eye rubbing or allergies can have an impact from the outside. At the deeper levels, what is often the case is that when the skin is very thin, you can actually see through the skin to the underlying structures, the blood vessels and the muscle. So when we address patients who have a very obvious constant puffiness with discoloration, the approach that I generally take is to do something to reduce the puffiness. And that procedure would be called a lower eyelid transconjunctival blepharoplasty. What that means is what we're doing is addressing the fat pockets that are causing the bulge from the inside of the eyelid. This is done under local anesthesia with light sedation. From the outside, to deal with the skin quality, we address the skin in 2 directions. Under the skin, we treat the skin with the material from your own blood called platelet-rich plasma. Platelet-rich plasma is a concentration of the wound healing and growth factors such that the skin, which is barely 0.5 millimeter in thickness, has some more quality and volume in terms of collagen and blood supply. From the outside, we also improve the skin quality with something like a fractional erbium or CO2 laser. This helps tighten the skin, it helps resurface the skin, get new skin to come in, and improve the overall appearance. So this combination approach is very typical. Let's say you went for a consultation and it appears you don't have that much fat prolapse. You have a mild amount and you are also interested in improving the skin quality. Well, then there's also an option to do this non-invasively or less invasively, and that's to use a filler such as Restylane or a hyaluronic acid filler into the area called the tear trough. By placement of the filler in the tear trough, you soften the transition between the under eye bag and the adjacent lower eyelid so that it doesn't look as puffy, because the puffiness makes the hollow look deeper. You can still use platelet-rich plasma, and there's actually a benefit synergistically in improving skin quality and tissue quality when platelet-rich plasma and hyaluronic acid are combined. So there are options for you. There are pluses and minuses to all of these options. But what is important to understand is that you can make these decisions based on what your unique situation is, which requires a proper examination and meeting with a doctor who can perform all these procedures. So that's what I would recommend, is meet with a qualified, experienced cosmetic surgeon who has a lot of experience with under eye bags as well as these other modalities, and see what if you're comfortable. Once you figure out what works for you, move forward and take the next step. Again, there may be some value to taking little steps where you do a less invasive procedure first and then move on to the more definitive procedure. Very often, depending on the person's anatomy as well as aging, we will combine procedures. We can do puffiness surgically to reduce the under eye bag, fillers to fill anatomic natural hollows, and PRP for skin quality. So it's not just a procedure, but it's really the doctor's approach to addressing the problem, and that's where a consultation is important. So I hope that was helpful. I wish you the best of luck, and thank you for your question.